Hello, fellow people with type 1 diabetes. My question to you today is, do you still eat 15 grams of carbohydrate every time you're low? Well, if you do, you actually need to learn a new way to treat your lows. That's what I'm going to answer in today's video. So my name is Dr. Jody Stanislaw, and I've had type 1 for 40 years. I work with patients all over the world through a virtual practice, and I have online courses. We with type 1, I feel, are often very uneducated on what we really need to be taught to learn how to thrive with this condition. That's why burnout is so rampant and elevated A1Cs are so rampant, is because this takes a lot of motivation and education to get right, right? So let's see, I've had it for 40 years, having a pretty good morning. I got super stressed. That actually was, I was just super stressed this morning. That's not too high. I think I went up to like 170 or something. And that was just straight adrenaline stress. But thank goodness I'm back down to a flat line. So that's cool. But I'm here to motivate and inspire you that if you're struggling with your diabetes, we don't have to be struggling as much as we are. Most type 1s have not received the education that we need to really thrive. So I figured this out because, I've been going to docs for 40 years, and that's why I've dedicated my whole career to helping you. So why were we taught 15 grams of carb and wait 15 minutes for every low, right? That's what we're all taught. I certainly know I was taught that however many decades ago. And, they try, and that might work, but it doesn't always work. And I'll tell you why. They try to make things really simple, right? And they try to give us all these ratios and formulas. But here's the reality. We cannot be put into a box with type 1, right? Your insulin to carb ratio changes every day, every hour, there's a lot of variables besides your carbs that you need to consider when you dose. So yeah, you need to kind of know a ballpark insulin carb ratio, but if you think that's the only information you need to know how to dose, it's not gonna work, right? I have a whole course called Nutrition and How to Dose that if you wanna learn how to better dose, that's a great course for you. But the reason why this eat 15 grams for every low and wait 15 minutes isn't gonna work is because let's say I had a flat 80 blood sugar level all night long, right? Well, I don't need any carbs to fix that. If I'm flat at 80 during the day or during the night and I don't have any insulin on board, then that's a cool number. It's the low end of normal, but it's still normal, right? So I don't need any carbs, let alone 15. However, if I had just taken 4 units of insulin, let's say an hour ago, and now I'm 80, well, depending on, of course, how much food I ate between the 4 units and now, who knows how many grams of carb I need. But 4 units for me personally is a lot, right? And how long does it take for a rapid to peak? It takes an hour, assuming you weren't really active after you did your shot. Because if you're really active after you give your 4 units, then it'll peak faster, okay? So we have to think before we treat a low, okay, how much insulin do I have on board? The more insulin you have on board, the more you'll likely have to treat, right? The more carbs you'll need. And you also, though, have to think how much food is still digesting, right? So if I ate a huge dinner and I gave myself 4 units, and it was protein and fat and carbs, let's say like that. Not that I do that very often because that would be stressful. And I gave myself 4 units up front, and now I'm going low. What's probably going to happen is I probably will have to treat that low in the moment, but I'll probably start going high after that because my 4 units worked up front too fast, and I should have perhaps spread out the dose. I should have used a pump and used like a square wave bolus. Like, let's say I need 4 units over the next 3 hours. Or because I'm on shots, what I would have done is maybe 2 units at the time I ate, and then 2 units maybe an hour or so later, right? That's why carb counting doesn't work. It just assumes that we can give all the insulin we need all at one time. And that often doesn't work. That ends us up having a low before all the food is digested, which then leads to a high later. right? So that's why my course, Nutrition and How to Dose, is so valuable, because it can help you better understand how to microdose, right? We don't necessarily need all that insulin at once. So when you're having a low, you really have to think about, how much insulin do I have on board? The more insulin on board, the more you likely have to treat the low. But how much food is digesting, right? Am I going to have to treat this low, but realize I'm going to have to give more insulin later as my food continues to digest, right? So, or am I a flat 80 and I don't need any glucose, right? Because I don't have insulin on board and I'm staying flat. So this whole eat 15 grams and wait 15 minutes, that's one scenario, but there's so many other scenarios for lows. So if you want to really dig into understanding this better, that's why I made the course Nutrition and How to Dose, because we've got to really consider many more variables than just what our number is. People will say oh, well, when do you feel low? And I never can answer that question, because I can even be a flat 75 and not feel low, or I can be 75 arrow down and I already felt low when my meter said 95, right? I can feel low when my meter says 95 because I already can feel that I'm headed down. So I can't ever answer the question what number do you feel low at? I'm well, it depends what momentum is behind my number, right? So these are really important questions that I hope you guys are grasping. I'd really love to help you go deeper. And so check out my website, is drjodynd.com. It's probably right in the little comments above or below. And then you can click on T1D classes. And this course, Nutrition and How to Dose, it's a huge help. I also have a course, How to Get Off the Blood Sugar Roller Coaster, which is my foundational course. And I have a course, Mastering Your Blood Sugar with Exercise. So I work privately with patients all over the world. I just had a patient in Italy. I got to practice my Italian. That was fun. I have a family in Israel and patients all over the US and more. So if you want to work with me, just click on Let's Chat, and my little calendar pops up, and then we can have a call. It would be fun. So I am Dr. Jody Stanislaw. Thanks for watching. I have tons of videos on my Facebook page. I decided once we all were in lockdown to start doing little 5-minute tips on my Facebook page, and now I love them. I'm meeting so many new patients and people are finding my courses, so maybe you're my next patient. Let's see, who's watching? We got lots watching. Suzanne, Connie, Mindy, Sandra, Elise. Elise, good to see you. You're on a lot. Mindy, always learning. Thank you. Melissa, Mayetta, Sandra, wish I was a robot. Yes, well, we're not robots, right? These formulas aren't always going to work for us because we're not robots. Lisa, Clifford, Kathy, Nancy, Carol. Great, you guys. Let me know what you like about this video, what you've learned, what has helped you, what questions you want me to answer in tomorrow's video, okay? I come on pretty much close to 3 p.m. Pacific, 6 p.m. Eastern, Monday through Friday, right here on my Facebook page. I've been doing these videos, like I said, there's probably, who knows, 10, 20, 30 of them now. If you scroll down on my page, I'm answering tons of questions because we with type 1 deserve better. We with type 1 deserve healthy A1Cs, right? At A1C below 7 or even below 6.5 is when you're in the non-immunocompromised zone, right? If you have a high A1C and crazy blood sugar levels, that puts you in the immunocompromised group. But just because we have diabetes doesn't mean we're immunocompromised per se, okay? It really has a lot to do with what your blood sugar levels are doing. So get good blood sugar levels. Now is the time. Either have a call with me, check out my courses. Great resources. I'm here for you. So have a great day. Bye.